Appreciate you being here. Welcome to the latest Duke media briefing on the COVID-19 pandemic. I'm Greg Phillips with Duke Communications. More than 2,000 Americans have been killed by the virus every day in the last month. About 4.5 million Americans have received a coronavirus vaccine so far, but that's a long way short of the 20 million the federal government set as a goal for the end of 2020. With me today to discuss the slower than expected vaccine rates so far and what to expect in the coming weeks is Dr. Mark McClellan. He's a physician and economist who directs the Duke-Margolis Center for Health Policy, where he works on strategies and policy reforms to improve healthcare. He was previously Commissioner of the U.S. Food and Drug Administration and Administrator of the Centers for Medicare and Medicaid Services. Dr. McClellan, good morning.
Greg, good to be with you. Happy New Year to you and the rest of the participants today.
Thanks so much. We'll just jump in and get started. Broadly speaking, what do you see as the main reasons that vaccinations are happening more slowly than predicted? And what, if anything, can be done to speed that up?
Well, there's not one main reason. This is the most complex undertaking ever in the United States public health history, I think, in terms of the number of people who need to be reached, to vaccines, complex conditions for storing and transporting the vaccines, all in the midst of an unprecedented public health emergency. So this is complicated. It is going to get better. I think in terms of the numbers that we've seen so far, the federal government was really focused in their early work on distribution from the manufacturers out to healthcare providers, nursing homes around the country. And if you look at those numbers, it fell short of the 20 million. About 15 million doses of vaccines were distributed by the end of December. So that's about 25% less. Why was that? Well, it was a little bit of disruptions and the supplies coming from the manufacturers a bit slower than the federal government had been expecting and planning for. Also, the federal government's held back some of the doses because these two initial emergency vaccines are two-dose vaccines, and they've prioritized making sure that there are going to be doses available for people to get their follow-up shots. Those follow-ups are starting to happen now that we're 3+ weeks in for the Pfizer vaccine. They'll start happening soon for Moderna. So those additional doses will go out for the follow-up vaccines too. So that'll close a bit of that gap. But the real challenges have been in getting that sort of the last mile or the last inch, if you want to call it that, from the vaccines that get distributed out to a healthcare facility or that are going to be used in a nursing home, getting from there into people's arms. And that's not a matter of logistics and distribution at the national level and shipping and refrigeration. It's a matter of things like what's the capacity for these healthcare organizations to set up vaccination programs. Many of these, remember, these hospitals and nursing homes are very hard hit right now by this unprecedented surge that we're in the midst of. How much willingness is there on the part of the affected staff or residents to take the vaccines in these high-risk groups? There still is a significant amount of skepticism among particularly some subgroups of the population about the safetiness and a lot of wariness around the vaccines still. And, add in all of those local logistical details for people who are for healthcare organizations that are very busy. And you can see why it's been a bit of a challenge. Finally, there's some data issues involved. People are just getting used to entering all the information about who's gotten vaccines, sharing that up. So I think there's probably a bit of a lag. We're probably doing a little bit better, at least, than we think we're doing. And I think this is all going to get better over time. We're going to get more experienced with how to do this work locally. There is some significant federal financial help coming in the weeks ahead. You all may recall the president signed legislation late in December for coronavirus relief that included $8 billion, mainly to states and local government to assist with these efforts. They can do things like staff up and expand their phone lines. And a lot of things have been part of these glitches and complications early on. So those are all likely to get better. If you look at vaccination by day, that is going up. It was low to begin with, a few 100,000 doses per day, now up, I think, over 500,000. The incoming Biden administration says that they're aiming for 1 million a day. I think we can actually do better than that if we expand the avenues for getting access to vaccines, if we have some more extensive public sector, private sector collaboration, instead of just relying on, very hard hit hospitals and very stretched public health agencies. So maybe we can talk a bit more of that about that, Greg, as we go ahead.
Sure, absolutely. And thank you very much for those comprehensive comments. We've had lots of questions come in already, so thanks very much for that. I'm going to get through as many of them as we can. But in the meantime, if you have questions, you can pose them in the Q&A window, or you can raise your hand in Zoom. And if you're calling in by phone, you can raise your hand by pressing *9, and we will get to you and unmute you so you can ask a question. But I will go ahead and press on with some of the questions we've had come through. First one is that the governor in North Carolina and elsewhere have mobilized the National Guard to help with vaccine distribution. What kind of role can the Guard play in these states? What logistical function? How can they help?
The Guard has played an important role in many aspects of the public health emergency response since the beginning of the pandemic, in helping to deliver supplies, in helping with testing in surge areas. And now I think it's a very appropriate use to help with access to vaccinations. So as I mentioned earlier, one of the big constraints right now is just bandwidth. Hospitals do not have a lot of staff that they can devote to expansive vaccination programs. They're very stretched. So the more that we can augment them, the better. There are lots of ways to do that. Using pharmacies, for example, is something that the Department of Health and Human Services announced today that they're planning to try to expand in the nearer term than they had previously been planning. And National Guard troops have been very helpful in many aspects of the response. So my preference would be to see the National Guard help focus on some of the highest risk groups that are otherwise hard to reach. We're going to be able to reach some of these groups. There are a lot of people who want to get the vaccine now, who will stand on a line, who will call repeatedly until they can get through in some of these high-risk groups. I'm also worried about reaching frontline healthcare workers who may not have time, frontline workers besides healthcare workers who may not have time to do all of that, bringing the vaccines to them through special events, reaching neighborhoods and communities where we're worried that vaccine uptake is going to be low at the same time as the burden from COVID has continued to be high. So lower income neighborhoods, neighborhoods with high rates of minority or immigrant populations. Those are where I think the National Guard extra help could really come in handy. And I think you're going to see more of that in more states. As you said, a lot of governors have started calling in National Guard assistance to help with this last mile problem.
Sure, absolutely. Thank you. You mentioned vulnerable populations. We've had a number of questions come in about nursing homes, long-term care facilities. So I'm going to pose a couple of those now. As of January 4th, apparently only 8% of the available doses allotted to long-term care facilities in North Carolina had been administered. So the question there is, where is the break in the supply chain? And are there other resources that we could marshal, such as the Medical Reserve Corps, to vaccinate people in these long-term care settings?
Yeah, I'm not sure about the National Reserve Corps. So one main mechanism for getting the vaccines into arms in nursing homes has been the federal government setting up a program with a couple of major pharmacy chains, CVS and Walgreens, to basically bring in staff and linked to all the vaccine supplies to try to get through a whole nursing home population in a day, and then do that repeatedly in additional nursing homes. Unfortunately, that's turned out to take more time and more effort than people had originally planned. And I do think that, again, that I expect the numbers to pick up more there. We're seeing higher rates in some states around the country as these CVS and Walgreens supported solutions have helped. But it is an area where there will need to be some additional attention. I think the latest projections are that while the numbers are going to accelerate, it may take not getting nursing homes done by the middle of January, but maybe more like late January into February. Those are still the highest risk settings for poor outcomes from COVID, significant risk of spread, Greg. So we need to keep our attention there and keep bringing in some additional resources to help make sure that nursing home patients and staff are getting vaccinated. There's also an issue here around, in some parts of the country at least, many of the nursing home staff have declined to get vaccinated at this stage. So we need to pay attention to not just the logistics of getting people getting the shots available, but the communication plans, the outreach, and helping people who do have questions still about the vaccines to know that there are places to go for reliable information. We've seen now a lot of data with millions of doses administered that the vaccines are safe. And we know that they have significant, big help in reducing the risk of COVID complications. So hopefully that education piece is going to help us increase uptake as well, starting with nursing home workers.
Sure, thank you. And I'm glad you brought that up because we've had a couple of questions, one in the Q&A and one previously submitted, about this apparent reluctance among large chunks of long-term care workers to get vaccinated. And I realize this is a crystal ball question, but I mean, what do you think is fueling that, given that, you know, these are people on the front lines who are seeing the effects of the virus? And is there anything that we can do other than what's already been done to address any reluctance or concern amongst those workers in particular?
Yeah, these concerns, unfortunately, are not new. If you look at surveys of the American public, and especially subsets of the public, people in more rural areas, Republicans now, people from racial and ethnic minority backgrounds, there is more skepticism out there. Some of that is long-term skepticism about, experimental, or what people think of as I think in this case, not correctly, is experimental treatments. These are treatments where there's a lot of evidence behind them, as well as a lot of concerns about the politics of the past year, where we saw confidence rates in the public in vaccines go down with all the political debate around the speed and mechanisms by which vaccines were being developed. What I hope people will take away, and I hope will help them be able to get access to this information, is that there is now very strong information on the safety and effectiveness of vaccines. We've seen leaders from throughout the public health community, in government, out of government, Black, brown, lots of different backgrounds, state very clearly and put their arms out to get vaccinated. I do think we haven't done enough on the public education, and this is not an ad campaign issue. It's really a public education issue. The Centers for Disease Control has noted that they are planning a major education and outreach campaign, but they're not planning to start it till later on in January. I think that's a kind of a missed opportunity for giving people quick access to resources that they can use and trust, and opportunities to learn more about the vaccine. There is now an unprecedented effort underway by the Ad Council in collaboration with a group called the COVID Collaborative, which is a big network of organizations. We at Duke-Margolis are participating in this effort. You can get more information about it online. They are about to launch a public education outreach campaign too, focusing first on healthcare workers and then on the broader American public. That involves a lot of private sector entities as well as in collaboration with government. These steps are just so important in helping people understand what the vaccine means for them, and what they need to do to get, if they're not confident about it, if there is skepticism out there, there are a lot of resources that people can use, and we need to do more to help them get access to that information and make a hopefully confident choice. That's what it's going to take to get out of this pandemic.
Sure, thank you. Moving back to people who are keen to get the vaccine, one of the things we've seen here in North Carolina and elsewhere is that counties are progressing through phase one at different rates. Some counties here in North Carolina are telling people 75 and older they can start signing up, and other counties say they're not at that stage yet. Does this add to confusion? Should states be moving at the same pace, for each state, or is there value in just every county moving as quickly as it can to get to the next segment of the population?
Well, states are taking different approaches, and there's some states, for example, Florida, that's already providing broader access to people who are over 65. And I think you're going to see more of this variation emerging across states as we get past the so-called phase 1A, where there's kind of general agreement that we should really start with people in nursing homes and with frontline healthcare workers. Now, the other high-risk groups recommended by the CDC and its advisory committees by the National Academy of Medicine also include frontline workers in other categories, school teachers, grocery store workers, first responders, people who are in prison where there have been very high rates of spread and morbidity and mortality, as well as a broader range of the higher risk populations in the public, people over 75, maybe people over 65, people with comorbid, serious chronic diseases. So you're going to see more variation emerging across states in their basic plans for how they're planning to expand access. And also, I think seeing more pressure with the vaccine numbers not being where we'd ideally like to see, more pressure to expand out access. So in North Carolina, the state's made very clear that if you haven't used the vaccines that you've been allocated for your first priority groups, if they're still sitting on the shelf, we're not going to send you more. We're going to prioritize sending it to other areas where it's more likely to be used sooner. I think what that's going to do, Greg, is create more movement out of these very top priority groups and into broader segments of the population. So you're seeing that starting to happen around North Carolina now, where, as you said, some counties are already making the vaccine available to people over 75. There are a lot of people in that group who want to get vaccinated really badly, to the point where they're called in hundreds of times or sat out for hours waiting for a vaccine. I hope we can get to better mechanisms for making it easy for people to find out exactly when they can get a vaccine in their county or locally, and how they can make an appointment to do so. This is a tough situation to just show up, because we don't want to spread COVID any further, and these are populations who have some underlying health concerns or frailty, and we want to make it as easy as possible for them to get the vaccine. So we have a lot more work to do there. That's where I think some of that federal funding that's going to be distributed soon could help, where people get more experience can help. And again, relying more on the private sector too. CVS, Walgreens, these pharmacies already have appointment systems set up, and so you can call or use an app to get a specific time, avoid standing in line. You're going to see more people getting access through those mechanisms too. But it is going to be different, probably from county to county, and different eligibility across states too. So very important for people to get access to local information on where you can get vaccinated, whether you're eligible now, and very important for all of us who are involved in the response to make it as easy as possible for people to get reliable information, not have to stand in line, not have to make dozens of phone calls. And we really want to make it easy for people in the highest priority groups. If we don't do that, what's likely to happen is we'll keep moving down the list, but we're going to be missing a lot of higher risk individuals along the way. And that's going to get more people vaccinated. That's a good thing. Every person who gets vaccinated is one less risk of a poor outcome, and one person less that could be a burden on our very stretched hospital systems. But I do worry about that becoming uneven in terms of access, with lower income groups, minority groups, maybe in a tougher position if we don't make it very easy for people in these high risk groups to get vaccinated.
Sure, absolutely. Thank you. Thanks, everyone, for all the questions. I'm going to get through as many of them as I can in these last 10 minutes. We certainly won't get to all of them, but we'll do our best. Related to the point you just made, Dr. McClellan, we've had a question. If we do get a huge surge of people in the 1B phase, seniors over 75, essential workers getting vaccinated, what can be done to ensure that there are the sufficient resources to get people their second dose in the right time frame? You mentioned about some of the doses being withheld. And what happens if these people don't get their second dose within the recommended time frame?
So far at the federal level, the federal government's very much prioritize keeping second doses available and building into their distribution plan that those doses go out to the same places, 3 or 4 weeks before that got what were intended to be the first doses. So as long as healthcare organizations and others that are doing the vaccinations can keep up, can provide sufficient access, the federal government's trying to make that as straightforward as possible. Let's be realistic. That is not going to happen in every single case. There are going to be gaps, people missing the vaccine, people who don't get their information tracked properly. Right now, we don't have a whole lot of evidence on what happens if you delay your vaccine a bit. I think based on what we know from other vaccines and the strength of the response and a few variations that happen kind of accidentally in some of the clinical trials that have been done, if you don't get your second dose right at that scheduled time, that's probably okay. If it's a week or a few weeks later, probably still going to get a pretty strong and lasting immune response. Further out from there, we're just really in uncharted territory from the standpoint of what the clinical evidence has shown. There are other countries that are, because of they're facing even bigger surges than we are, for example, in England, that are looking into more flexibility, maybe just doing single doses and the like. That's not what the US is aiming for right now. And I think if we really ramp up our capacity to give doses of vaccines, that means moving beyond very stretched hospitals and very stretched public health systems to include pharmacies, to include primary care groups. The state of California is working with dental assistants, people with some medical training who can help give vaccines. We've talked about National Guard. If we really ramp up these additional sources of vaccination support, we should be able to avoid those kinds of big delays in the second doses happening at a large scale.
Sure, thank you. You mentioned earlier prisons, and we've had a very good question about that. Several states, including North Carolina, haven't yet released their public plan for vaccination distribution within the prisons. What's the potential impact on the state's general public health, if any, if distributing the vaccine to people in prison is deprioritized?
Well, it certainly has an effect on the people in the prisons, and that includes not just the prisoners themselves, where the rates of infections and mortality rates among older prisoners have been incredibly high across the country, but also the people who work there. So prisons in some of the, especially more rural communities where they're located, are an important part of the economy. The people who work there are serving a critical public safety role in their jobs, and to the extent that they continue to be affected, that's a real challenge. Some states have prioritized prison workers over prisoners, but if you really want to prevent the opportunity for spread from places like that back into the community, and if you really want to get the burden on healthcare down, vaccinating in prisons early is an effective strategy.
Sure, absolutely. Thank you. Because we've had this question for a number of different people in a number of different ways, I'm going to pose it to you again. And I know, as you said, there isn't a main reason for this, but are there one or two things in particular that you think would be the most effective things that could be done in general to speed up the vaccination timeline and the rate of vaccinations that we've seen?
Yeah, I think number one, expand as quickly as we can the help that we're getting in administering vaccines. So beyond hospitals, beyond very stretched public health departments, let's find ways to partner with pharmacies. They have significant capacity. Let's find ways to partner with medical practices, not hospital-based, but out in the community. Those are not places that are doing a lot of vaccinations right now. It's envisioned they would become part of this over time, but I think we need to accelerate that process to the extent we can. We've talked about National Guard helping, and along with this, very important to not just try to move down the list, but to pay close attention to where gaps are emerging. So North Carolina, other states are tracking not only the number of people who get vaccinated, but where they are, what communities they're in, what kind of backgrounds they have. Are they in nursing homes? Are they in other high-risk settings like prisons? If we see gaps emerging, that's where we really need to put some additional public health efforts. That's where the public health offices should really be focusing their efforts. That's where we probably want to focus the National Guard and the other assistance that the public side can bring in. But let's complement that with more involvement of health insurance plans, more involvement of pharmacies, more involvement of medical practices. They all want to help. They're not as much quite as much at capacity as the public health and hospitals are right now. And on top of that, Greg, there is more funding coming soon. So the federal government needs to move along quickly on distributing some of that money from the legislation that passed at the end of December to help states ramp up the use of National Guard, to help states ramp up targeted efforts for high-risk populations, and then let's expand out the work of the private sector in collaborating on improving access to vaccines too.
Gotcha. Thank you. And before we go, you've alluded to the fact that federal funding is coming, additional funding. Obviously, it looks almost certain that we're going to have a new presidential administration here in a couple of weeks. There are clearly no magic bullets for this pandemic, but is there anything that you expect a Biden administration to do on day one, or any significant changes that can be made in the short term to help in this situation?
Well, Greg, the Biden administration has already identified dealing with COVID generally and increasing vaccination in particular as among the highest priorities for the incoming administration to help us move beyond the pandemic. They set a goal of 1 million vaccinations per day for the first 100 days of the administration. We are not there yet, but we are headed in that direction. I think over 500,000 per day now. We ought to be able to get there with the steps that I just described. In fact, we ought to be able to get well past 1 million doses per day. We expect to have from the vaccines that have been approved, the two that have been approved, maybe 150, 180 million doses at least by the end of the first quarter of 2021. There are one or maybe two other vaccines coming along, J&J, and just full disclosure, I'm on the J&J board. That may have a readout in January and may become available if it looks like it actually works well as soon as February. So we've got enough vaccine supply. What we're seeing is we've got to match that up with the ability to go that last mile or that last inch into people's arms. And I think we can get to well over 1 million per day, maybe a goal closer to 2 million per day, given just how severe the pandemic is, something that's achievable. But it is going to take a lot of action on all of these fronts we've described, bringing in more capacity to do vaccinations, especially through partnerships with the private sector, bringing in more public education and outreach around helping people get their doubts or concerns about the vaccines addressed, and especially focused on some of the lower income and minority communities where I think we're already starting to see some disparities emerge.
Gotcha. Thank you very much, Dr. McClellan. We've reached time now, so we'll call it there. Thank you so much to everyone for joining us. Thanks to Dr. Mark McClellan for sharing your perspective. If you'd like to be notified of upcoming briefings, please email dukenews@duke.edu. In the meantime, please stay well, wear a mask, and get vaccinated when your turn comes. Thanks, everybody, and have a great day.